Let's take today and talk about something that will help make you a better agent for a specific niche of the population. This is something that affects, about 4 to 8%, depending on who you ask, of the Medicare eligibles every year. And that's understanding how the Medicare Savings Program works. So we're talking about QMB, QUIMB, SLMB, SLMB, and QI1. And there are some other state specifics, but right now we're just going to deal with federal level. So these programs can help pay someone's Part B premium, and in QMB's case, can even eliminate Medicare cost sharing or your out-of-pockets, right? So we're talking about huge financial protection eligibility, and there are a handful of myths that agents have about eligibility that they repeat over and over, and we need to clean these things up. This is Ansel, who's a little tired because I just got through dancing with my wife. Probably about a 6-minute Medicare minute. Let's do it. All right, so let's target shoot and bust some of these myths that I hear, maybe not on a regular basis, but anytime the MSP thought is at least brought up. First myth that I hear, if someone spends money on medical stuff, that will help them qualify for Medicaid spend down. Now, not usually. There are state-specific incidents of this, and if we're talking about Medicaid off, traditional Medicare off MSP, yeah, absolutely. MSP eligibility, though, isn't based on how much someone spends each month. It's based on countable income under SSI-related Medicaid rules. It means you generally can't go in and just buy things like a dental plan, a vision plan, or extra coverage and expect those plans to lower your income for MSP qualification. Now, this isn't like a rolling spin down system like medically needed Medicaid categories, depending on the state you live in. It's a different program, even though it still has Medicaid in the name, so they use different math with it. CMS and Social Security both confirm that MSP uses SSI income methodology when they are evaluating your QUIMB, SLMB, QI1 access. So voluntary purchases then usually don't change eligibility. Second myth. If someone misses QUIMB or QMB by a little, they're out. They have no reason to even apply. That's not true. In fact, even on the form, it says if your income is a little over, go ahead and apply. So remember, there's 3 Medicare Savings Programs tier levels. There's QMB, there's SLMB, and there's QI1. They all can pay Part B's premium, and usually Part D's premium up to a set dollar amount. QMB just also pays all your copays and out-of-pockets on traditional Medicare. So QMB is the one that's most sought after because it pays the most for you, right? And it saves not just your entire Part B premium and usually Part D, but also your copays. And usually agents tend to treat that like a pass or fail, but it's not. It's a ladder, right? So just because someone doesn't qualify for QMB doesn't mean they can't qualify for extra help, LIS off MSP, or SLMB or QI1. Third myth. Your assets always disqualify you. That's not true. In fact, let me pause. Medicare Savings Program does have a resource limit. Those assets don't count, though. Your primary residence, at least one vehicle, any personal belongings you have, burial plots or burial spaces. Also, there are states like Alabama, for instance, that do not count your asset limits against you, right? So you could have more than one car and they're just looking at income. I've seen agents assume because someone is over-resourced that they're ineligible, when in reality that might not be the case based on your state. Fourth myth, doctors can still bill you if you are a QMB patient if Medicare does not pay them enough. Absolutely not. Federal law prohibits a physician or any provider from billing a QMB beneficiary for Medicare deductibles, coinsurance, or copays. This isn't just like some type of reduced billing that a member can access. No, it's not partial billing. It's completely prohibited from a physician or any clinician or provider billing you for the things that Medicare or Medicaid does not cover. In fact, CMS has provider guidance specifically warning against billing QMB patients for approved Medicare and Medicaid procedures. If someone properly is enrolled in QMB, then their Medicare cost sharing is legally protected. And that's huge consumer protection that most people don't realize and they're afraid of. Fifth myth, let's see. Eligibility would be obvious from someone's Social Security income. No, not really. Not only do your assets count depending on your state, but MSP eligibility is based on total countable income after Social Security style exclusions. So that means some income that a member has may not count fully. It means that some deductions that they have may not apply. And the state dependent state that you're in, the processing, how they administer this matters. So two clients with the exact same gross income can sometimes have different countable income outcomes. And it depends, they could be right next to each other on the map in two separate states and one qualify and the other doesn't. So you can't just eyeball eligibility based on the Social Security benefit amount that your member receives. So you always need to do your due diligence in checking how your state or that member state calculates countable income. You can't just treat MSP eligibility like it's a quick yes or no screening. It's not just looking at someone and saying, hey, so-and-so, what do you make? That's not reality. Or what's your total household income every month? You have to take into account what counts towards that income or what counts towards those assets. Because once someone qualifies, especially if we're talking about QMB, their entire Medicare cost, experience, and exposure will literally change overnight. And it's one of the strongest financial protections available in the entire CMS or Medicare system. And you can verify all this. This is what I want to encourage you to do. Go to Medicare.gov, look up their MSP program or their Medicare Savings Program pages. Go to CMS.gov, look up the MSP eligibility guidance. Look at SSA's SSI income and resource counting rules. This isn't like some insider thing that's kept real secret, but there are a lot of myths that are worth busting, right? The program was written to help people with low income take care of their healthcare needs. And honestly, understanding the MSP eligibility correctly is probably one of the biggest differentiators between just being a Medicare agent and an actual advisor for someone that's going to give them value that they can take for the rest of their Medicare life.